Good afternoon. Welcome to the Assess Needs and Resources In-Depth webinar, which is part of the County Health Rankings and Roadmaps Take Action series of webinars. My name is Karen Odegaard, and I am a community coach with the County Health Roadmaps Project. My colleague, Kate Konkle, is also here to help answer your questions along the way. We are also pleased to be joined by Amy Neuwelt, Prevention Specialist with the Public Health Institute in Oakland, California. So welcome, Amy. Thanks for being with us again today.
Thank you.
The County Health Rankings and Roadmaps program is the result of the contributions of many partners, and we want to acknowledge those folks here, including the Robert Wood Johnson Foundation, our colleagues here at the University of Wisconsin Population Health Institute in Madison, Wisconsin, where Kate and I are sitting, and the various partners who help us compile the rankings data and get the message out about rankings and roadmaps. We want to take a moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of two parts, and on the left you can see the viewer window on which you'll see my screen throughout the presentation, and on the right you can see the control panel, which is where you can interact with us. And we've created this webinar with your participation in mind, so as we go through today's webinar, if something sparks a thought or a question, please feel free to enter it into the question or chat interface, which you can see here. So we're going to start with a question so you can practice using the interface. And we'll start by having you enter your county, your state, and a word or two about how you got to work today in the question or chat field. So I had meant to bike today, and Kate, I'm sure that you meant to bike today as well, but we had pouring down rain this morning.
We did have pouring down rain, so I bused to work today.
And I took the opportunity to drive so I could stop and run some errands on the way in, but I hope to build a bike this week. All right, so we've got folks here from Bullitt County, Kentucky, and that's Cynthia, who drove 38 miles to work.
That'd be a long way to bike.
That'd be a long way to bike, yeah. Shelby County, Indiana, where Betsy is working from home. That's always nice to e-commute. Let's see, Bethany in Carroll County, Maryland. She also drove, and as did Michael in Summit County, Ohio, and Anna and Kate Gerardo, Missouri.
It's like lots of people with long driving commutes.
Yeah.
We have some good books on tape or something.
Yeah, exactly. All right. Whoa. Nancy, driving 42 miles. Yikes. Well, welcome, however you got to work, whether you're working from home or working in the office, and we're really glad that you're with us today. And we are going to start with a quick outline of what we're going to be doing today. So we started with this welcome and check-in. We're going to also walk you through a really brief orientation to the Roadmaps to Health Action Center. And then we'll talk with Amy about chna.org and how it can help hospitals and organizations seeking to better understand the needs and assets of their communities. We will talk through a couple of questions that you all asked when you registered for the webinar, and then others that come up throughout the webinar. So again, feel free to at any time enter a question or a comment into the question box. We definitely want to hear from you throughout the webinar today. So when you registered for this webinar, we asked you to let us know what's going well with assessing needs and resources. Here are some of the themes that came out of your responses. And I think a lot of communities find this one, where as you're starting to do an assessment and you bring different partners together in the community to accomplish this common task of assessing your needs and resources. And I think that a lot of folks experience this success, and that's a great way to get started. Others say that they've successfully collected data and that they have used that data to select their priorities and to really set a direction for their future work. And then some have noted that they've used their assessed needs and resources, their assessment, to communicate with key stakeholders. So think about which of these successes have resonates most with you, and what's missing. What other things have been going well in assessing needs and resources for you? I think that this is pretty reflective of what I often hear from communities, and I know, Kate, you do a lot of work with communities as well. Is this
Yep, I think this seems to be what comes up the most, and again, with this audience, it seems to be consistent that getting people to the table and finding data. Sometimes the knowing what to do with the data can be a struggle, but so if there's anything missing here, you can certainly chat in the chat box there. Let us know, and we can talk about that as the webinar continues.
So we also asked you to talk about what's been a challenge, and you'll see that some of the things that come up here are very similar to what we saw in the successes. So some folks said that progress is slow, and working from assessment to assessment over multiple years, you feel like past efforts really haven't resulted in a lot of impact. So that can be a challenge for folks. Engaging partners in the community in your assessment. We talk about partnerships, and that's great, but actually getting out to the people who live in your community or who are served by your programs can be a little more challenging for folks. And then, again, finding data. Some people, this is a challenge for people, and so we hope that today's webinar will help with that piece of assessment. And often, communities will run into the fact that the groups who should be partnering on assessment are also strong competitors. And so I think that is also a common challenge for people. As I said, today's webinar will focus primarily on the challenge of finding secondary data using one of the tools that we feature in the Roadmaps to Health Action Center's Assess Needs and Resources Guide. And so we'll hear more about a tool that can help with that. Are there other challenges that we don't have included here that you're all experiencing? If so, go ahead and enter those into the chat feature, and we'll throw those out as we're going.
And again, feel free to use both the question and answer and the chat feature throughout the webinar as questions pop into your head or comments, and we can try to answer those either as we go along or towards the end of the webinar.
So let's just do a quick orientation to County Health Rankings and Roadmaps, specifically looking at the Roadmaps to Health Action Center. The County Health Rankings helps communities understand what's making them sick or healthy, and the County Health Roadmaps helps communities take action to create healthier places to live, learn, work, and play. So what we're looking at here is countyhealthrankings.org homepage. And from here you can use the map to get to your county's ranking and data. And you can also click on the County Health Roadmap section of the website. From here, you'll find a variety of tools and guidance to assist communities, and you'll find those in the Action Center. In the Action Center, you can click on any step in our Take Action cycle to find guidance and tools for various activities that make up that step. So we're going to just, as an example, look at the Assess Needs and Resources guide here. And here you can see that we've broken this step down into 10 key activities, so you can find guidance and suggested tools for exactly where you are in the process. And this is how we've handled all of the guides in the Action Center. Amy is going to walk us through chna.org. This is a tool within Community Commons, and chna.org is one of the tools that we feature in our Assess Needs and Resources guide. So I want to take a moment to introduce Amy. Amy Neuwelt is a prevention specialist with the Public Health Institute in Oakland, California. She currently serves on the work group for chna.org, a free web-based platform designed to assist critical access hospitals, nonprofit organizations, state and local health departments, and other organizations to conduct robust community health needs assessments and design effective implementation strategies. Amy also leads the design and implementation of a customized data, communications, and content management system for 42 California counties that are participating in the community transformation grants. She holds a BA in community health from Brown University and a master's of public health in population and family health from Columbia University. So Amy, I'm going to turn the webinar over to you now to walk us through chna.org.
Great, thank you so much. And I just want to confirm first, can you see my screen over there in Wisconsin? Are we working?
Yep, I can see it.
Okay, great. I'm just going to minimize this here. Okay. Hello, everyone. Thank you so much for having me on this webinar today. It's an exciting opportunity to showcase this one tool that I think really aligns well with the County Health Rankings Action Center and Roadmaps tool. I am with the Public Health Institute in Oakland, California, and have been working with a broad group of stakeholders on the development and promotion of chna.org, which is really a free tool within the community commons. Right now what you're seeing is the homepage, the new homepage for the community commons. If you haven't heard of it, go to the site at www.communitycommons.org, and I highly recommend that you register. Again, it's for free. And this site really is targeted on sustainable collaboration and access to data for the Healthy Communities movement. It's created by a group from the University of Missouri as part of a nonprofit called IP3, or the Institute for People, Place, and Possibility. And these great folks have been doing work with data and GIS mapping for many years and have created the community commons as a place to access and visualize data, but also stimulate dialogue around our work. They just recently released a new updated version of the site. I think it looks fantastic, and the GIS data components themselves have really been upgraded to be more user-friendly and dynamic than ever before. I'm scrolling down just to show you there is space for different blogs and information around healthy communities and a lot of the work that we're all doing across the country. And you'll see that there's two main tabs at the top. There's maps and data, and there's groups. So just very quickly to show you, under groups, there are spaces for collaboration and dialogue around different work, including community health needs assessments. And then also maps and data. So there's opportunities to make a map and also possibilities to build a report. And all of these tools are embedded within the CHNA toolkit. So you can also go to www.chna.org, and you're going to get to the CHNA toolkit within the community commons. Again, this was developed by a diverse group of folks representing health departments, hospitals, community organizations, with really the idea that let's make public data publicly available, part of this data democratization movement, and make sure that folks have ready access to secondary data sources to assess the needs and resources in their communities and conduct meaningful community health needs assessments. Of course, a lot of the impetus is around new requirements under the Affordable Care Act with respect to nonprofit hospitals and community benefit community health needs assessments, also FAB accreditation for health departments, the CTG grantees, community transformation grantees across the country with CDC funding to do healthy communities work, and all other sorts of needs for GIS mapping to really make the case, visualize, and analyze where needs and resources are and where investments could be placed within communities. So if you go to www.chna.org, or again, if you go to the tools within chna.org within the community commons, you'll get to this page. There is an overview video here on the left, and also the folks from IP3 will post updates to the data. If there's ever an indicator that needs correction or update, they'll post that here. And you'll also see a section for FAQs, some other video, really great and helpful video tutorials and resources. And I'll point out actually on resources that just like with the action framework for the county health rankings and roadmaps, there are sections with tools to help you throughout the process, including the What Works for Health link from the County Health Rankings model. So I'm going to go back to the Maine Community Health Needs Assessment homepage. And there's 3 different data tools that I'm going to be demonstrating for you today. And at the end, if you have questions, I'll be really excited to hear your questions and also thoughts and feedback as we continue to improve this tool as a public utility for folks to do their work in a more meaningful way. So the 3 tools on the site are the Vulnerable Population Footprint, which is a way to identify health disparities or potential issues of health equity in order to target where you might want to do community health assessment and improvement work. Also a series of reports that you can produce for your community. A lot of the data, most of the data are county level because that's the data that's available. But where possible, there certainly are a host of indicators at the sub-county level to really let you get a little more granular within your community. With these reports, you'll see that there's different options. There is a core health indicators report that focuses just on a limited number of indicators that leading folks around the country have identified as being really important starting points. There's also a full health indicators report with all the data in the system. Leading health indicators, so you can see how your county compares with Healthy People 2020 metrics. And other CHNA reports that are aligned with what health hospital systems are using for their community health needs assessments to meet their community benefit requirements, such as Kaiser Permanente and Catholic Health Association. So you can go there to produce a report for your community and look at the specific metrics that align with what those hospital systems look at. Then the third tool is this Health Indicators Map Gallery. So with all of the data in the system, you can also produce interactive maps. You can save them to your profile within the Community Commons. You can also save them as an image file or as a PDF and print them for later use. But also what I would encourage you to do with these mapping tools is to think about some of the analysis capabilities on the site for you to really delve deeper into the data and do some queries to identify some areas of greatest need within your community. First, before I dive into the first tool, I do also want to really pay attention to the linkage between the data within this system and the population health model that the County Health Rankings folks have produced, and it's just really so fantastic for our field. When you look at the data within our Community Health Needs Assessment report, you'll see that the indicators are aligned with this population health model. So while a lot of the data within the system are also data that are presented in the County Health Rankings tool, you'll see that there's additional indicators that align with what we know are these important elements, health factors that impact health outcomes in a community. So just thinking about that when you go into the tool to see how the data are really aligned with this population health model. So starting with the vulnerable population footprint, I'm going to click on that tool. And I'm going to type in the location. First, I'm going to go to Camden, New Jersey. And that's going to zoom us into the city of Camden. I'm going to zoom out just a little bit. You'll see on the left, just like you'd see in a Google map, that you can zoom in and out here. And what you're seeing on the map right now are 2 different indicators and also an area where those overlap. And the idea behind this tool is to look at 2 important proxies for population health and really social determinants of health, and those being poverty and high school non-completion. So the orange census tracts, and this is all data from the American Community Survey, show census tracts that meet a certain threshold that you can set interactively, and I'll show you that in a second. The percentage of folks within that census tract that are below the poverty level. So you can click on the census tract here. We're looking at this orange tract. We can see the label that over 31.8% of folks are living below the federal poverty level. Click on the map, you can get some more information. So that's the orange spaces. The purple are for population with less than a high school diploma. And then the red areas are an overlap of vulnerable populations that meet both criteria for both of those metrics. So if you look over on the right, you'll see that we have this clicked because we're looking at that that indicator for both poverty and high school non-completion. And scrolling down, you'll see we also have hospitals. And the main idea was to think about how hospitals, but certainly other stakeholders as well, can do collaborative assessments and really think about where they would want to target and invest their resources, not necessarily by a hospital service area, but where areas of greatest health inequities and need are. I'm going to also add on the county boundaries real quick. And then going down to the footprint definition, you'll see that we have these sliders. And the orange slider at 30% means that right now on the map, we're identifying which areas in which over 30% are below the poverty level and 25% have less than a high school diploma. But what we can do is we can increase the threshold for both of these indicators up to 40%. And the highlighted census tracts on the map are now more limited because we're getting stricter in our threshold. We only want to look at over 40% for both indicators. So as a collaborative group, whatever your process may be or your community, you can come up with some sort of benchmark and a way to identify where do we want to focus in terms of greatest needs for our assessment and for some of our implementation planning. So that's our footprint definition. You can also produce a report using the current map area, or you can actually draw a custom report area. So if I click on this radio button for Draw Custom Report Area, I'm now going to go to the map and say I just want to focus on the vulnerable populations within the red census tracts in this area here. And now we can open. And we have a map that you can print and save for that particular region. It shows us that we've set those thresholds at 40%. It gives us the data sources. And also we have the basic demographics. So we're seeing the population density breakdown by gender, race, ethnicity, and by age. And again, so for those red census tracts, the number and percentage of folks in poverty for that area. So that's the first tool, and that can really be a starting point for doing your assessment. Again, another thing is you can also link this area that you've designated to the Community Health Needs Assessment report tool that I'm going to show you next. You can actually have the areas you've identified here transfer over into a report for those areas, and I'm going to show you the report tool right now. So I'm going to go back to the home page. I've shown you the vulnerable population footprint, and now we're going to look at one of the health indicators reports. And I'm going to go to the full health indicator report. Before I do that, I'll show you that there is a list that you can download of all the indicators in the system. You can, at the bottom, there's a button to export this into Excel. But this shows you all of the data by category, data source, geography, and what reports within the system it's available in, if there's any benchmarks, whatnot. So this is really helpful if you just need to have a spreadsheet to show you all of the data that are available. So going back to the Community Health Needs Assessment tool, I'm going to go down to the full health indicators report. And I'm going to first pick the state. I'm going to go to Iowa. And then I'm going to select two counties that are next to each other in Iowa. Contiguous counties, Dallas and Polk. Okay, so I've selected my area. That's the first step. And now I can view the report for this area. So for those of you doing this work, you might have had experiences where you've had to spend a lot of time collating and identifying all of the data that you now just within a couple seconds have available to you from myriad data sources. I mean, this includes the American Community Survey and U.S. Census, data from HRSA, data from CDC, CMS. This is all now available for you to download into a Word document as a full report, so you can add or remove text as you like. You can save the report, pick and choose what you need, but really the idea behind this tool is not only to democratize the data and make it available to you, but also streamline that process of aggregating and collating and visualizing the data. Because really what we want to do is we want to work on the collaboration process, and we want to work in the implementation phase, thinking about some of those challenges identified earlier. How do we not lose steam from the assessment process when we're moving it into implementation? And really this tool, we think, is a great way, at least with the secondary data, to streamline and accelerate the process around data analysis and visualization, so that you can focus on implementation and also primary local data collection if you also want to give some of a qualitative voice through focus groups and interviews for your community. So looking at the top of the report we've just produced, you'll see that there's these different headers. We're starting with demographics, but again, the other headers align with the population health model from the county health rankings folks. And scrolling down, I'm just going to show you a couple of examples. For each indicator, there's going to be some text to describe why that indicator is important and what it is. Population density isn't necessarily the most robust example, but there is that contextual information for every indicator. And then you can look at the data in a variety of ways. You can look at it as a table, as a map, and I'll show you in a second. You can also look at it as a dashboard. So what we've done is, since we've picked 2 counties, we're seeing those highlighted here in the report tool, but also the report area. So this gives us an aggregate for both areas combined. And this is really helpful, particularly for rural areas or any area in which, thinking about the geographic boundaries, you want to do some sort of collaborative assessment and look beyond your own geographic jurisdiction. You can do that this way. Just like with the target area needs assessment tool, you can kind of redefine those geographic boundaries of where you want to focus your work. You can download the data. If you click here, you can download the data themselves into Excel, and you have the data sources below. Scrolling down for demographics, you have your typical pie charts and information breakdowns by race, ethnicity where available, percentage Hispanic, Latino, and footnotes. So you have all of the methodology and background for the data and any notes that you might need. Both at the top and the bottom, you're going to see something that says report options. Here is where you can look at all the different indicators that you have in your report. You can add or remove indicators. Some of them are identified as being some of the core indicators. You can also limit your report only to those indicators for your region that do not meet benchmarks for Healthy People 2020 or are worse than your state average. So that's a way to kind of get a more consolidated report and really identify those areas of perhaps greatest importance, depending on how you're determining that. And you can, again, download the report here into Microsoft Word or a PDF and save the report. And you can register with the Community Commons and save it to your profile there. So in addition to demographics, I want to show another example of an indicator. Let's look at the physical environment for a second here. And I want to look at fast food restaurant access. Okay. So again, here's some context about the importance of this indicator, some information about it. And for the most of the indicators, you're also going to see this visual dashboard that will also be downloaded into your report. And this is another way, I think, to really display the information in a clear way, especially if you're working with community members or other folks who have less familiarity or less, not as much of a data geek as I am or other folks in your team may or may not be. Another way to display the information. So the way this works is that just like a stoplight, green is go, green is good, red is stop, red is bad. The idea being is you can make some comparisons. So our report area is Dallas County and Polk County together as a combined report area. And we're seeing on this visual that the needle is in red. And that's because the rate of fast food restaurants, which we know can have an impact in the physical environment on population health, higher than both in the United States in blue and the state of Iowa. It would be green if for that report area it was better. However, looking a little more green, we can see that actually the rate is for smallest county, higher, and the population is much larger, thereby raising the rate for the report area as a whole. So you have this information for a lot of information, a lot of indicators throughout the system, and again, you can download the whole report. One about this tool that I'd encourage you to consider to use it interactively in some of your meetings. I think I worked with a group with Kauai County, and during itself, it was actually very to have this available and have the leadership team ask about certain information or look at it live with the groups and with the folks in the meeting. Okay, so I just have a couple minutes left, and I want to show you the third tool. I'm going to go back to the main homepage. Yes.
I'm just going to throw. We did get a question here that maybe you want to speak to a little bit as you're continuing your demonstration. So this question is from Vicki in Mason County, Washington, and she's asking how. And I think you kind of started to address some of this, but how can the tool be used most effectively in small rural counties? So, for example, if their population is only about 60,000 and only has one incorporated city, what are some of the best ways to use this tool? I think we also want to make sure, at that size of a county or even smaller, will they find data on the site?
Great. Now, that's a great question. Thank you for asking that. So the concept behind this tool is to make to be able to produce a data report and get information for any U.S. county. So the data that I've shown you so far is available for any U.S. county. There may be a couple exceptions for certain indicators, but you will be able to get secondary data for your county. There is always the challenge when there are smaller population sizes in terms of being able to get more granular data, getting sub-county level data. I think with this tool, particularly some of the thinking around the conception of this tool was for critical access hospitals, those hospitals with under 25 beds who also have their community health needs assessment requirements. And how can they also use this to identify needs and think about where they might want to do some collaborative assessments. You can think outside your county boundary. You can think about surrounding counties. Where are some of the needs? For that vulnerable population footprint, you are going to be able to get census tracts, the sub-county level data for your county. Even though your census tracts might be quite large, it'll still give you a little more granular perspective. And if you're working with other stakeholders in other counties or hospitals, health departments, financial institutions, which other groups, to look at where resources are in your communities. I think when you have a chance to play around with the data for your particular county, you can see some ways in which you can both identify need and also really show what you already know, which is where are the most folks living in poverty, where are they located, where are the folks with least education. A lot of times we know this, it's just a matter of being able to communicate it. So those are some of the ideas. I think that's a question we could get into for even a longer period of time. And if I have not addressed it, please re-ask it. Okay, I'm going to move down to the Health Indicators Map Gallery. And again, this is where you can really get a little more nitty-gritty and interact with the data, because what we have is the ability to create GIS maps for every indicator in the system, again, aligned with the population health model from the County Health Rankings and Roadmaps program. If you go into the community commons in their data mapping environment, you're going to have access to even more data and maps. But what the idea with the CHNA specific tool was to provide some level of limitations and synthesis, because there's so much data available. How can we focus on some of those indicators that folks think might be most important for doing these types of assessments? So one indicator I was going to look at that might be of interest are ambulatory sensitive conditions. So conditions that could be prevented or cared for in an outpatient setting. So I'm going to go down to clinical care. And I'm going to open that map for that indicator. The default is always Atlanta, but what we do is in the top right corner, turn that off, I'm going to look at a statewide level. And again, this is also helpful for looking from a county level perspective, because we can see the state of Washington. I'm going to zoom out a little bit. And we can see some differentiation in terms of the rate of, for Medicare enrollees, and this is data coming from the Dartmouth Healthcare Atlas, of ambulatory care sensitive conditions. So hospitalizations for things that could have been treated in an outpatient setting. These are the map layers that you have on the right. This is in one of the tabs. Again, you can always click on the map to get some more data for that particular county. This is Yakima, who knows if I'm pronouncing that right, county, and some of the underlying information, including the confidence intervals and the data collection year. You can click on info to get info on this data. And if where available, you can change the geography. So we're looking at county, but I'm going to click on other. You can see that this data is also available by health service area, so you can actually get a little more granular. What we have for by default here are federally qualified health centers. You can add that as a layer. You can always turn those off. Certainly, if you get a little more granular, you can get into adding some more context in terms of transportation and highways. But I'm going to go down to tools. I'm going to quickly wrap up here and show you a couple things. So one thing is that you can add data. So let's say right now, oh, actually, sorry, there was one more thing I wanted to show you with the, I know I had turned on these SQHCs. One of the data tools that you can use is selecting data. You can do that by making a rectangle, polygon, or lasso on the map. So for example, if I really was looking at this particular region, and this is just a random case example, but let's say you wanted to identify all of those FQHCs, federally qualified health centers, which are healthcare access points and can be resources in a community. You can do that to assess and identify which ones are in a particular region. You can also do that for hospitals, schools. There's a lot of point level data because you can, what you're doing is you're adding point level data on top of some of these chloroplast maps or color-bound data. So what we did is we just identified 20. Oh, you know what I actually, yes, you know what I actually just did? I made a mistake, and this is a good thing for you all to know, and watching my mistake, is what you want to do when you're doing any sort of selection. It's within layers. You want to make sure the indicator that you want to identify is the one that's highlighted in this tan color. So I still have it under ambulatory care sensitive conditions. That pulled up the rates for all those areas in which I had made that square rectangle. If I had clicked it over like I was supposed to FQHC, now we can select, and you're going to identify all the FQHCs in that area, including the zip code, name, street address. So again, a good way to identify assets, and those are now highlighted. Last thing I'm going to show you is to add another data layer. One of the health outcomes that we have in here, it does come from the county health rankings system as well, which is premature death, a health outcome. I'm going to add that data. I'm also, and now that's overlaid, so we're seeing that in green. And I'm going to add percentage of students eligible for free and reduced price lunch. So this is going to show us schools. And I'm going to turn off the FQHCs just by unclicking it. And now we're seeing all the schools. And as we see in the legend, the red are the areas where over 80% of students are eligible for free and reduced price lunch. So one thing that you can do is, again, select the indicator that you want to query or investigate further. Go down to Tools, and you can click on Query. You can see it says for students eligible for free or reduced price lunch. I'm going to click on % of students eligible, greater than or equal to, let's say 90%. Let's say we want to have a higher threshold. And now again, we could have zoomed in and looked for in a much more granular geographic location, but just from the where we were looking, the scope we were looking at, we now have 122 schools and the information. Again, you might want to target your work in a particular area based on this particular metric. Okay, so that was a fast overview. There's a lot really more that you can do with this tool, but I certainly want to open it up for questions.
Great, thank you so much, Amy. That was really helpful overview, and I think that gave folks a much better sense of how they might use chna.org in their community. We want to open it up now for your questions, and as you're thinking through what you just have heard and seen from Amy, we wanted to start with a couple of questions that we received during the registration. So, but first we have a really quick question, whether the website is accessible from the County Health Rankings website, and it is linked from our Assess Needs and Resources Guide. And Kate will send out the link for our Assess Needs and Resources Guide now, so you can see how that links. So when folks registered for today's webinar, we asked what questions you most hope to have answered, and we want to pull out a couple of those for discussion right now. So feel free to chat in your own suggestions as we're talking through these, or any related questions as we're talking. But one of the questions that we received was, so you have all of this data that you've collected, perhaps you've used a combination of secondary and primary data collection methods. How do you take that data and make sense of it to really help you set your direction? How do we put it all together and figure out where to next with our assessment? And I think this is just a really great question. It's one that a lot of communities struggle with, is how do they actually use the assessment that they've done to figure out where they're headed next. And one of the questions that folks sometimes will have with this more specifically is, say they've looked at their assets and they've looked at their challenges, and now they're trying to figure out which do they use to figure out where to next. Do you go with where things are going well and try to build off of those things, or do you try to target the challenges in your community and really work on those things? So I want to open that up for discussion with Amy and Kate and myself, and then if you have suggestions or thoughts on how you work on this in your community, please feel free to enter those into the question field.
Yeah, and this is Kate, and I get this question a lot from communities. And the more that we encourage communities to really look at both assets as well as gaps, I think it does become a difficult balance of then where do you focus your time and attention and your energy. And I think the answer to that is there is no right answer. Every community is going to have a different solution that makes sense for them, and it really is about having the conversation with the community about where are your resources, where is there energy in the community and interest in making an impact, and do you really have the capacity right now to address those big gaps that we know are important and are essential to address, but maybe are a little overwhelming, especially if you're starting out as a new group. Maybe that low-hanging fruit makes a little bit more sense to start off with, and to pick some of those easier things where there's already some momentum, there's already some energy and community interest, and then eventually moving on to thinking about those larger gaps and areas where you might get the bigger bang for your buck and might have a larger long-term impact, but that will take some more time. And I think it's a balance of those things, and I think it's just communities recognizing that either is okay, either is good, as long as you're doing what makes most sense and is most responsive to your community needs.
We have a comment here from Michael, which I think is another helpful way to think about this, where they've done surveillance and gap analysis to identify areas of needs in their community, but then they also think about how can they focus and direct the existing resources to fill those gaps. So, in a lot of ways, it may just be making the connections in your community to start to address some of the gaps and the needs that you're seeing, maybe in certain populations or certain geographic areas of your community. So I think that's a really great point. Thank you, Michael, for sharing that. I think another thing that communities can do, and Kate alluded to this, is maybe you go after some of the low-hanging fruit, but then you can start to stage what you're going to be working on. So as you build your capacity in your group, and as you start to get some early wins, you can start to build towards maybe those more challenging, addressing those more challenging needs in your community, and thinking about that your work isn't limited to just one 3-year period, or one 5-year period, that you're continuing to build this year after year. Amy, do you have anything that you want to throw in on this question?
No, I mean, I think everything you guys have said are really interesting and good points. And I think in terms of thinking about consensus building and that collaborative process with communities and other groups, I think many folks are probably doing this, is thinking from the get-go, kind of before delving into the data and before delving into existing work that's being done where you want to go. It's kind of thinking about what those decision points are going to be around prioritization and around how how community needs and resources are going to be explored, identified, and prioritized as a group process. Because I think after the data is collected and discussed, there can be different opinions and there can be different priorities for different folks. So kind of having some decision rules at the outset can be really helpful.
Yeah, I think that's a really good point, Amy. Thank you. I want to move us to another question that we had, and I think this will be really relevant to many of the folks who are joining us today. How can hospitals best impact the health of their community, and thinking outside of their own 4 walls, or how do they really start to make an impact in their broader community? And I'm hoping that some of the folks who are joining us today might have some examples of what they're doing in their community or what they've seen their hospitals do. But for our discussion among the 3 of us here as presenters, I think this is, from my perspective, I think this is an area that hospitals are starting to do some really great work in, and we're hearing more about this from communities that are partnering with their hospitals and trying to figure out what can they do to address issues like social and economic factors in their community and health behaviors beyond just what happens in the clinical setting. So I think that there's a lot of progress coming from hospitals in this way. Kate and Amy, I'd throw it to you to see if you have any thoughts or examples that you can think of.
This is Amy. I'll just say I think there's certainly tremendous opportunity with the work of hospitals and the impact they can have on their communities through this assessment process, and certainly in terms of investment of resources, and certainly with the Affordable Care Act and a lot of the movement towards global budgeting. Now we're getting some more of those financial incentives aligned to think about upstream determinants and to think about prevention. I think these types of tools and the way that we can communicate data and need, it can be really, really useful for collaboration with hospitals, public health departments seeking accreditation and otherwise, and local community groups. I think being able to talk on the same plane, not just around indicators and getting into the granularity of confidence intervals, but really thinking of those upstream determinants and thinking about where inequities are and where investment of resources might be made, so that a hospital that is placed as an anchor institution in a area that has less need might think a little more collaboratively and strategically about where they will want to kind of focus their work. So I think there's tremendous opportunity and some really great work being done across the country with hospitals.
Another point that I would add to that, Amy, I think that's really true, and I think especially in some of our rural communities, hospitals have this really great position of being well respected and having a leadership role. So they have an opportunity to help bring other partners to the table that maybe haven't seen a role for themselves in improving population health in their community. So I think that we can use hospitals, or hospitals can really play a role in helping leverage those partnerships throughout the community, because they have that sort of, they have a different level of influence there that can be really helpful and again, especially in rural communities.
Yeah, I think that role of leveraging partnerships can be really essential in thinking, again, beyond those four walls and the individual-based clinical care, and really focusing on how, as a community, can we work together to prevent people from needing to access care at the same level. So I think that's an important role that they can play.
Great. And feel free to add any comments that you have, again, in the question feature.
So we do have a question about engagement, and really how engagement can be one of the hardest, and engaging the people that you're trying to help can be really difficult. And I think that is also a common challenge that we hear from a lot of communities. Communities often do a pretty good job of bringing agency leaders or agency representatives to the table to maybe talk about what's going on in the community, but really getting authentic voice and input from the populations that you're wanting to impact can be a huge challenge. And I don't know, again, there's not any easy way to do it, but I think spending time building relationships, talking to the agencies that work with those populations about the best way to build relationships, and the best role that those populations can play. Do they need to be part of the coalition? Is there other ways to get feedback? In our Assess Needs and Resources Overview webinar 2 weeks ago, Dr. Ball talked about using focus groups and doing focus groups not with the community leaders, but with community members, with the people who really were impacted by the health issues that they wanted to address. And so, again, it can be a challenge, but it takes a lot of effort. It takes going out into the communities, not always inviting people to come to your meetings, but going to theirs, or going into the community and doing door knocking, and you know, the good old-fashioned hit the pavement and go door to door. And you know, I think I've worked with some people who do a lot of coalition building, and they talk again and again about, we've gotten into this habit of wanting to invite people to our meetings, and we're successful when people come to our meetings or our coalition events, and that we really need to go beyond our own four walls and extend ourselves and join other groups and really meet other people where they're at, and not expect them to meet us where we are. So going into the community, I think, is a great strategy. Having, you know, and I just was listening to someone who talked about, you need to provide child care, you need to provide transportation, you need to provide food if you really expect community members who have all of those challenges of, you know, how do you have someone watch your kids. And we know that that can be a significant challenge in communities that are trying to do assessments on shoestring resources. But thinking about creative ways to be able to provide some of those things, I think, will increase the commitment you'll get from community members. And we also have some links in the Assess Needs and Resources Guide to tools like Photo Voice, which can be a great way to get community members who maybe don't feel like they have a strong local voice to contribute in some really interesting and creative ways. So definitely check out those primary data collection activities that are in the Assess Needs and Resources Guide, so Photo Voice and surveys and focus groups. Those can be good ways to get voice from the people that you're trying to impact.
Yeah, I think that's a really great, and thanks, Kate, for also pointing people to some other tools that are in our Assess Needs and Resources Guide. I just threw out that link again in the chat feature. So, maybe if you have a few minutes, spend some time exploring the guide and see if there's resources there that can be helpful to you. We are approaching the end of the hour, so we want to wrap up. And thanks to the support of the Robert Wood Johnson Foundation, we do have 3 community coaches in the County Health Rankings and Roadmaps program, and our assistance is available at no cost to you. So please don't hesitate to contact us if you need assistance with a tool, if you have a question, a follow-up question after today's webinar, or in general. If you're wondering about the next step in your process, we are definitely here to help. And so you have my information, Kate's information, and our colleague Jan's information here. We have 3 series of webinars going on throughout the year. 2 brand new ones will focus on breaking down the rankings model, and then another on partnerships. And then today's webinar is part of our Take Action webinar series. So we regularly send out announcements about our upcoming webinars to our e-newsletter subscribers. And if you haven't subscribed to our e-newsletter, now is a great time to do that. As always, we invite you to stay connected with us, and here are some ways that you can do that by following us on Twitter or friending us on Facebook, or liking us on Facebook, I guess, and subscribing to our e-newsletter. So we want to, as a checkout today, we want to hear back from you. What's one thing that you heard today that you will take away from today's webinar and use in your community? We really appreciate you taking time to be with us and for participating in today's webinar. And we'd love to hear what you hope to take away from today. Someone has asked whether we would be sending out an email or putting the links that we included throughout today's webinar in the newsletter. And I think that we can definitely put together a little a follow-up handout, if you will, that will include the links that we talked about today, so we can send that to you via email.
So it looks like one of our takeaways is a new data source, and I think again, chna.org is a great tool for communities looking to get some secondary data and get some ideas of where they might want to start digging deeper and looking into all those different health factors in their community. So it's, again, one of many resources and tools that we have available in the Assess Needs and Resources Guide, and I think Amy did a fantastic job of a very quick but pretty in-depth overview.
A couple people have commented on how they plan to use the maps, and one person has indicated that she's going to be using them during a coalition meeting. I think that's a great way to use some of these tools going forward as a way to inform your stakeholders and your coalition members and help bring them along in the assessment process.
Yeah, and the idea that maps are visual, and people respond to that visual data so much more than just throwing out statistics and numbers. So I agree with all of these comments coming in about just the interactive maps and that they're very visual for people to really understand and be able to see, how some of these different factors overlap, and the fact that they are so interactive.
And thank you, Amy. We want to just take a minute to thank Amy so much for your help and your demonstration. I think you've given folks a really great sense of how to navigate chna.org and really start to use this in their communities. So thank you for your presentation today.
Thanks for having me.
And we hope to see you on upcoming webinars when we have more coming up. Our next action step we'll be focusing on is focus on what's important. So look for more information about that in our e-newsletter coming up.
Yep, and that will be on June 18th.
Great. Thank you very much. Have a great day.